we have a half-hour presentation where we try and teach you about IBD. And today we're going to change that up a little bit. We're going to have a question and answer period. It's your opportunity to type in your questions. We can see them up here on the screen, and we'll be able to talk to you, answer those questions for you. And also Dr. Kroeker and Dr. Huang and I, we have some of our own questions that we want answered, and we'll be discussing those as the hour goes on. So welcome again to IBD TV, and let's get right to the questions. Maybe I can start by asking Dr. Kroeker. I said that this is a session on self-care. And maybe you can explain to the audience what I mean by self-care and what we think of when we're talking about self-care of patients.
I think the most important thing, it's not really self-care, but it's actually just managing your own disease. And so taking responsibility for actually recognizing the symptoms that you're getting sick, making sure that you're doing the best things you know how to do to stay well. And so often that's in terms of taking your medicines, making sure you have enough refills on time, doing your blood work that you need to do, and then knowing what to do if you flare. And so the first things in order to what to do with flare is to recognize when you are having a flare. And so for most people often when they flare similar to what they do when they initially got their disease. And so if you presented with a ton of bloody diarrhea, probably when you flare you're going to have diarrhea and it's probably going to be bloody. If you presented with terrible abdominal pain and bloating, because you might have stricture and Crohn's or something, then that's probably similar to what you're going to get. And then you have to know what to do about it. And so often it's different a little bit over the holidays, where we're going to talk a little bit about where you can go for care when the offices are closed and it's Christmas Day and that sort of thing. And so there's a lot of things that you can know what to do in terms of preventing and recognizing when you're sick and knowing what you do when you are. Mm-hmm. And so some of it has to do also what you do when you travel, but I think at Christmas there's a lot of people that travel and go other places during the holidays, and so that's one of the things to think about. And so I don't know where you want me to start with that, but... Well,
let's just hold that thought. I think the traveling, many of us will be traveling at Christmas. And maybe Dr. Huang, when you start to travel and you have IBD, what are some of the things that our audience should be thinking about? They're now getting ready for Christmas. They're going to be on a plane. They have Crohn's disease or ulcerative colitis and maybe having a bit of rumbling in their stomach. What kind of things do they need to do before they leave so that they can have a safe, fun travel?
Yeah, so I think first of all, make sure that you're well enough to travel. That if you're really, really sick and not able to tolerate intake and stuff like that, you probably shouldn't travel. But if you're doing okay and things are going well, then you just have to be prepared. Bring enough medications that you need to take. So depending how long you're going away for, then just bring probably a couple extra days of extra supply of your medications. If you have problems, for example, if you're known to have Crohn's disease and you have recurrent perianal abscess problems or stuff that recurs, you might want to bring an extra supply of antibiotics that has been prescribed to you. You also want to make sure that you have contact information. So have your physician's name and phone number, have a list of all your medications and the pharmacy where you get them from, so that in case where you end up going for your travels, they ask about questions about your medications, you have all those details. Yeah. Basic things.
In traveling, getting across the border, say you're going to the United States or going to Europe to another country, how do you need to have a special permission to take your pills with you, or can you have them in their bottles, or do you put them into one big plastic bag? What's the right thing to do?
To be safe, for most countries, you should have them in their original containers that has a label of your name and the prescription itself and the physician who prescribed it.
And what if you're on an injectable? What if you're using Humira, for instance, and you have a pen and a needle?
Yeah, those ones you can get a travel letter from. You just speak to your progress nurse because they need to have a letter to say, because it is a needle that you're carrying on the airplane, and they'll just give you a letter that says that you need it for this indication, and then that's usually pretty good.
Right.
Yeah. Another thing to remember is always to keep it in your carry-on. Your carry-on, not your checked luggage, because I don't know, an unnamed airline has lost my luggage before, really? So, oh yes.
So interesting.
Good thing I didn't have my medications in there.
And so what happens, though, Dr. Huang, if you lose your medication? Let's say now you're in Phoenix or maybe Las Vegas and you have an exciting night and you lost your medications.
Well, that might be a challenge. I think in that case, you may be able to call your pharmacy. If you're going to be in another city or something, they may be able to transfer a prescription to a local pharmacy, and then you can pick up the doses there.
Or if in the worst came to worst, you'd actually have to go and actually see a physician in the place that you're traveling. And so I think, it's one thing if it's going to be one day or you're going to miss your Imuran dose. It's another thing if you're going to be gone for a couple weeks. And so I think you have to be cognizant of that because, you don't necessarily want to sit in a doctor's office for a week waiting to get in just because you forgot your prescriptions. But it's always better to be prepared.
Right, because it's important to know that a prescription written by your doctor in Canada is not legal or valid in a U.S. state or another country. And so you often do have to go visit another doctor in that country in order to get a prescription for that
You've had trouble
state.
with that before?
No, but I've learned that from some of my patients who've traveled and lost their prescriptions, and then they have my prescription, but it's not valid. And some of the drugstores will arrange for that transfer, but they don't have to do that.
Well, and I think that's the other thing too. If you keep a list of your medications in your wallet as well about your medication and your dose, then if you lose your medications, and hopefully you don't lose your wallet as well, you actually would have a list or some sort of form of it so people could show what you're on.
Right. So that's important in self-care. Let's talk about some of the other aspects of travel now that we're on that. Let's talk about the food, Dr. Kroeker. So we've got quite a few questions here about foods, but you're moving to a different city in this Christmas period. You'll be eating different foods. Are there particular things that you think can trigger problems?
Well, I think you missed our seminar on diet, which we did a couple months ago. And so we actually talked about we don't know exactly which foods trigger things. We do think that probably if we look at all of the diet stuff, probably really high fat food can sometimes be the things that trigger. But often it's a change in diet. And so if you're not used to eating, you don't have milk every day and then you start having milk, you might actually not be able to tolerate it. So there's that kind of dietary changes you have to keep in mind. But also when anybody travels, depending on how different the food is. If you go to Mexico, it's different than if you just go to your aunt's house probably. And so it kind of just depends on where you're going. I think the one thing you have to be careful is to avoid, if you're traveling to like hot places, about avoiding infectious diarrhea. And so making sure the water you get is bottled and that sort of thing so that you're not eating a lot of food off the street and things like that. So you're careful to just avoid infections because people with IBD, anyone could get a food poisoning, but if you have IBD, you actually might not tolerate it as well. You might actually get a lot sicker than the average person. Yeah,
particularly if you're on some of the immunosuppressive drugs that can lower your immune system slightly, you may get a little bit more prolonged infection or be more susceptible to that.
And so do you tell people that they should get the diarrhea? What's that virus called? I mean, that vaccine called for traveler's diarrhea?
No, but I do suggest that if you are traveling, and we're getting into traveling and preventing diarrhea, that you do make sure that you've told your doctor where you're going, because there may be outbreaks in those countries. There may be vaccinations that you need to have, so that's important. The other is that you take a prescription for some antidiarrheal medications in case you get food poisoning. Nothing like being on a plane with a lot of diarrhea, and having some antidiarrheals will help you there. The other is taking a prescription for some ciprofloxacin, which is an antibiotic for 5 days, which can shorten the duration and severity of your food poisoning. So those are important other things that you need to have. And really for self-care, you should always have those in your packet of suitcase that you're taking with you.
So yeah, that is one of the questions listed, is that should I take antibiotics on my trip? And so Cipro is the one that you would recommend.
It can be good for your IBD in some degrees. It can help with the perianal fistula, but it'll shorten the course of your food poisoning. So
when would you tell a patient if they're having diarrhea to take the antidiarrheal versus taking the antantibiotics?
I think if you start with a diarrheal episode that lasts for more than half a day, you need to, because you don't know what the cause of it is, you need to start taking your ciprofloxacin. And you use the antidiarrheals as you need it in order to keep things under control. Right. So let's go right to the monitor here and ask a few of the questions. The big one that keeps coming up here is about wine and alcohol. I'm not sure why that would be on for Christmas time, but Can I have a wine or alcohol? Maybe let's just talk about it in general first. Dr. Kroeker, any comments on that?
So I think whenever we talk about alcohol, we talk about certain medications that you might not be able to take it on, but also for the most part, we talk about alcohol taking it in moderation. And so I think, we're also, as gastroenterologists, we also see patients with liver disease, and so we don't certainly want you to also develop alcoholic liver disease. But I think for the most part, many of our medications, it's safe, and as long as you're drinking in moderation and being careful about it, I think it's actually pretty safe. One of the medications you can get sick if you take it is something called Flagyl, and so metronidazole, sometimes people are on it either for perianal fistulas.
Metronidazole is Flagyl, it's the same word, yeah.
Yeah, it's the brand name and the generic name. Usually we call it Flagyl just because it's easier, but technically it's supposed to be called metronidazole. And we use that to treat something called C. difficile, or we might use it just to treat perianal disease as well. And so it's something to always check on. And I think when you pick up your prescriptions at the pharmacy, that's one of the things they would tell you, that you shouldn't drink alcohol when you're on it. It can make you quite sick.
So a couple of the other questions are a little more specific. They're talking about alcohol and steroids, alcohol and methotrexate. In general, when you pick up your prescription, you'll notice on the bottle often it will talk about not to be taken with alcohol. And the real reason for that is that alcohol can change the amount of these drugs that you absorb. So in general, if you're taking a small amount, a glass of wine, a couple glasses of wine, or a cocktail, a single cocktail, that's not going to change your absorption very much. If you are drinking more than that, that can really change the absorption pattern of your medications, and therefore change the blood levels of these medications, and actually could cause you some serious complications. But a small amount of alcohol in moderation is fine. Specifically with steroids and methotrexate, again, there's no particular problem. Methotrexate can cause some liver inflammation in certain people, and your doctor will be monitoring you for that. And alcohol can cause some liver inflammation. So in general, if you're taking two things that cause liver inflammation, it just means you're going to have to be a little more careful and use a little less of that alcohol if you're on methotrexate. But in general, I want you to have a Christmas, and if you feel you want to have a glass of wine or two, that should be fine with both your disease and your medication. I just want to pause for an advertisement now. This IBD TV is sponsored by an educational grant from AbbVie Canada, and they provide an unrestricted grant and to allow this show to progress. We also have partners, Crohn's and Colitis Foundation of Canada, an important partner with us, and the Canadian Digestive Health Foundation. Now, this is, I think, the 12th of our IBD TV shows, and just to tell you, we will be continuing next year in 2014 on a monthly basis, every second Tuesday. And all of the past episodes, as well as this show and shows going forward, are available for you to see on our website. And I'll just get the website put at the bottom of the screen there, but it's www.ibdclinic.ca. Simple, sign into that, and you can watch all of the previous episodes of IBD TV, and there's really a ton of learning on there for patients and physicians. That website also has lots of other information, where to go to get that information, and it has quizzes that you can take to see how much you know about your IBD, and so an important website to have as a favorite on your computer. So let's now go to another question. Question that I think Dr. Kroeker brought up. Most physicians will close their office for some period of time. There's always an emergency room, but to go to the emergency room can be long waits over Christmas. And how do you reach somebody if the office is closed? And really, what should you do when you start getting sick over Christmas Day?
Well, I think what it is, it's over the holiday period. There's often less hours for lots of clinics and things like this. And so the first thing is always to recognize how sick you are. And so if you're really, really sick, I think still the emergency room is still the best place for you. So there's always a gastroenterologist on call at the 4 hospitals in Edmonton. And the emergency doc would assess you, and they decide how sick you were, and they'd often consult the GI doctor that was working that day. And so there are people that sometimes get so sick that you do need to be admitted over hospital and over the holidays. And I think it's people are often hesitant to even come to Emerge because they know it's going to be busy, but if you are really sick, and so what are those signs of being really, really sick? If you're having a ton of bloody bowel movements per day, that's not good, and so you obviously should come in. If you have or cannot keep food down, and you're not able to maintain your hydration or nutrition. If you are obstructed, so you're just vomiting everything up, kind of like that.
So one of the patients yesterday, when I was telling them all of this, they asked me, well, how long if I can't keep food down? 1 day, 5 days, 3 days? Do you have some sort of rules for patients?
Well, I think what it is that in order for you, if you actually don't drink for a whole day, you can't keep stuff down, you're actually going to be pretty dehydrated. And so the first day, if you can't keep down, you try to do small amounts of liquids and things like that. If you're having severe pain and we think you're having obstruction or something like that, you probably would go in that same day. But I wouldn't stay home more than a day where you're not keeping liquids down because, you probably need some IV fluids or get some assessment. I think you don't want to be that sick. 5 days is way too long. You're going to be really, really sick.
I'd agree. That 24-hour period, if that's the critical time. When you go to the emergency room, let's talk about in general. I always think you need an advocate with you. Do you want to talk about advocacy?
Yeah, I think it's a really important point. So if you go to emergency, first of all, the doctors there don't know you, right? So if we were there and they called us and we knew you, we'd come and see you, and it would be easier for us because we've seen you 100 times and we know this isn't how you normally look. And sometimes IBD patients actually look relatively well because they're young. And so I think what it is the first thing is always, provide the information required. If you bring somebody with you, they can also talk for you and say that this is not really how this person normally is, and to kind of advocate for you to get the care that you need, and to say, you know what, this is a patient of Dr. Fedorak's and he's been on this medication and we're really worried about this. Could you possibly call the gastroenterologist on call to see me? And so it might not be myself or Dr. Fedorak, but it would be somebody that's trained in gastroenterology that would be able to see you. And I think it's a reasonable request. Sometimes, the emerge docs can do a quick assessment and they might actually think that you just have food poisoning, which is possible, and they might just do some blood work or some x-rays and things like that, and they do their own assessment. But sometimes, especially if you're really sick and this is very different from the way you normally are, I think it's really important that you communicate that normally I'm actually very functional and this is very different.
Right. And I think it also works both ways, because often the doctors in the emergency room, as you all know, they give you instructions when they want to send you home. You have to do this and this and this and this. And you're not feeling really well, and you don't pick up all this information often, and you miss. We've had many, many patients who've been in the emergency room have been given an appointment to see us, but then never got the appointment date or the time correct. And it's good to have someone else there to take all that information for you so that you...
And to make sure you have the right instructions. And often if they do send you home from the emergency room, they'll often tell you if this happens to come back. And so I think that's the one thing. If they sent you home and you're still at home and you're still not getting better, I think the important point is actually it's okay to go back, because I think that's sometimes what happens is that, if you are supposed to get better if the treatment they prescribe, but if it doesn't actually work, then you actually should come back and be reassessed. And it's actually best if you go back to if you go to the hospital where they know you, or so at our hospital, if you come to our site, and to go to the same one that you went to, so it's not, they did half of the assessment yesterday and you went home and now you're back and seeing somebody completely different that can't see the records. And so I think it's about that ongoing assessment that's really important.
Yeah, I also want to talk about ambulances. So in our area, ambulances will often go to the closest hospital. And actually, when people are sick, heaven forbid you have to take an ambulance to the hospital. But if you do, it's always good to tell that ambulance that your records or your doctor is at hospital A, B, or C, because the ambulance will make an effort to go there if they can. And it's always easier to be at a hospital where all your records are than if you're at some other distant hospital. So that's another point.
The other thing to remember with the ambulances is that as much as you can tell them that, often they will have additional information that maybe the emergency room at one hospital is totally overrun because there was a big accident in the area or something like that. And they might actually choose to bring you to a different one because of the wait lists and stuff at each hospital. And so they do sometimes override your decision. And so don't think that they're not trying to do what's best for you. They're actually trying to work on the whole system because they actually have that whole dispatching thing as part of the ambulance service.
Well, let's go to the monitor now and answer some of these questions. Maybe for Dr. Huang, the third question down. about the flu vaccine. Can I get the flu vaccine? This is the influenza vaccine, while on Remicade or Humira, which are two biologic medications.
So basically it depends on which flu vaccine it is, because there's that new one that's actually made for kids, like the nasal one. That one is a live vaccine. So when you're on these drugs, the Remicade and the Humira, you shouldn't take the live vaccine. So you should not take the nasal mist one.
But the injection one?
The injection one is okay, and you should get that one. Yeah.
What about other vaccines? Is there a general rule? You mentioned live vaccines. Is that a rule maybe?
Yeah, so if you're on those biologic medications, because they're immunosuppressants, you don't want to take live vaccines. So depending where you're planning to go for your travels, you should check in with a travel clinic, and then they'll recommend. So for example, like the one that comes off to my head is like yellow fever and stuff. You shouldn't take those. Right. So you may have to adjust your travel plans. And yellow fever,
generally if you're going to a place in South America, the jungle, or Africa, but most vaccines actually are killed vaccines, so they're safe. But you need to ask your travel clinic. I think Dr. Huang's absolutely right. Go to someone who's really knowledgeable about the area you're going to, and your vaccinations.
I think the other thing to remember about vaccines is that people that are immune suppressed often don't always mount the same response, and so you might not be quite as immune as other people. So you should always do the general other things to help prevent the spread of viruses, and so washing your hands frequently, kind of avoiding people a little bit if they're sick, because it actually just will make it better for yourself to try to. So my theory is you should just avoid children, but it's not always possible.
Hard to do.
For some people more than others. At Christmas.
Poor Santa Claus.
Santa needs the flu vaccine.
He needs the flu vaccine. Traveling. So a question here, does traveling cause me to flare? I read something in the news about studies showing that flying triggers flare-ups. Dr. Huang, I haven't read that study, but...
It was presented at DDW.
Do you think that flying is a major problem?
Yeah, that was a study that was presented in DDW I think it was 2 years ago, and they noted that in people who had traveled like at high altitudes, so like an airplane over a distance, that they tended to have a higher chance of flaring. But it's not definitive that it's actually like traveling in the airplane. Like it could be a whole bunch of other factors. Like was it that they were going to different places, and like we talked about the different diets that they were taking. It could be also time difference, because you're traveling across the world or across the country. You have different time zones, and there's a lot of like individualized personal reasons why traveling could cause some people to flare, and you just have to know yourself. You have to know your disease, and then. Right. Just adjust for that.
And I think often, like, anybody can have a change in their bowel habit when they travel, and I think that's some of the things that people need to keep in mind. I think part of it's because especially if you're flying, you're eating at odd hours, you're not actually walking around as much, there's lots of things that can cause that, I think. So
it may not be as much of a flare, but a change in symptoms.
And I think that's the thing that, that's why you have to look at persistence of things and not be like keen to just take prednisone at the first drop of a hat.
Talk a little bit about that. That's an interesting concept. Flare of disease, what doctors mean by that versus what patients mean when my symptoms change. So, Dr. Kroeker, how would you define a flare from a doctor standpoint? Then I'm going to ask Dr. Huang to define a flare from a patient standpoint. We'll compare those two. So
a flare from a doctor standpoint is actually when you have symptoms, usually, but also like a measurable as an objective measure of that you're actually sick. And so there's a number of ways. And so if we scope you and we see disease, we see inflammation and ulcers and things like that, we call that active disease and we call that a flare. Sometimes we use surrogate markers like blood tests, something called CRP. We sometimes look at that to see if you have signs of flaring. And then there's newer tests like fecal tests where you actually can look for inflammation in the stool. And so for us to call it a flare, we have to believe that the symptoms you have are related to your disease. So a doctor needs two things. A doctor needs the patient to say, I'm having some symptoms, and the doctor needs a test. Of some sort, yeah. Of some sort. It could be a blood test, a stool test,
X-ray, an endoscopy.
We've talked about it at other sessions where we have to talk about how people can have something called IBS or irritable bowel syndrome on top of IBD. And so sometimes you can have symptoms, but we don't actually see ulcers, we don't see any abnormalities in your blood work. And so we actually think that symptoms don't actually always equal a flare of your disease. And a flare for a doctor, we treat with medicines to treat that inflammation. But symptoms from something called IBS, we wouldn't use those same medicines to treat you.
So, Dr. Huang, how does a patient see a flare?
So I think it's more for patients is how it affects their quality of life, like the symptoms that they're having, and you can't tell. Like some patients are able to tell. Some people know their disease really well, and they know like I'm having a flare versus this is just something I ate or IBS. But sometimes you can't tell, and you get worried like if you're having more frequent bowel movements than normal, and you're having some stomach cramps. So they're going to think it's a flare.
So sometimes it's identical symptoms and patients know right away this is a flare. But if they're not really sure, how long do you think they should wait before if they're getting some change in bowel habit and they're traveling, should they go to the emergency room right away, or what type of time frame would you give them to sort of make some decisions around to see a doctor or not?
I think it depends on what kind of symptoms they are. If they're like just a mild, like little bit of stomach cramps and maybe one or two more bowel movements, if that just only lasts a couple of days and goes away, then that's probably okay. But if it progresses and starts to get worse, you start to have like can't take things by mouth, keep them down. Like if it's progressing, then I think you need to get checked out. Mm-hmm.
And I think it's also in terms of if you're actually having a lot of bloody bowel movements, so say you have ulcerative colitis, and so if you're having a little bit more frequency but not seeing blood, I think you're more likely to stay home and wait it out a few days. But if you start to see blood with every bowel movement and you're really quite sick, I think that's when we think that it's actually your disease as opposed to just something you ate.
So in the whole self-care notion, it's about can the patients adjust their own medications? So let's talk a little bit about medications. Can they, if they're traveling in Europe, a long ways away, having a flare, they're pretty clear it's a flare, can they adjust their own medications? And if so, how does that happen?
Well, I think you ask an interesting thing. Philosophically, can you or should you is probably a different question. And so can you is if you have medications with you, it's possible that you could. And I think whether or not you should is different. And so I think it's variable. And I think some people are able to tell that they're having symptoms, that it's real, that's really their IBD. Then I think sometimes we will send people with steroids to treat a problem that you might have. Whereas if you...
So do you give your patients those instructions?
For some, yeah. So I think I have to understand that I think that they are able to determine the difference, and I think I have to know that, when they're going to do it. And often I would actually tell them to let me know that they're actually doing that.
So here's a young university student going off to Europe for 6 months. Do you give them some extra pills and give them instructions on how to take it?
Mm-hmm. But I do also, I never want people just to take them and not let me know. And so actually... So
they can start some extra pills, but you have them phone you, email you, text you, Facebook you?
Not Facebook me. I'm not on Facebook. But I think the most important thing is that you have to understand your disease, and you have to know that sometimes it's hard even for us to tell if you're actually having a flare or you're having an infection. And so our medicines do not work well for infection. And so treating, if say I sent you with prednisone, treating infection with prednisone will actually just make you worse. And so that's the biggest reason why we don't often like to send people with medications to take on their own. It's one thing if it's a short-term thing. If it was 6 months, I actually would probably, if you were actually flaring and you were quite sick, I would actually want you to see a doctor there. And I think that's one of the things that you have to understand if you're traveling, especially for a long time, that you should have insurance. And your insurance might always cover you if you actually have a pre-existing condition, and that's something that you have to be willing to do.
Let's talk about insurance. We're moving into insurance, and we're here in Alberta. We recognize the IBD TV audience can be all across Canada, but Dr. Huang, let's talk about insurance. Are all of the medications that we have available for IBD covered by insurance here in Alberta?
So on a general basis, it depends on what the diagnosis is and what their insurance covers. So basically in Alberta, we buy prescription insurance, much like car insurance, and you get what you pay for. The more you pay, the more drugs that are generally covered. Is that sort of? And
fair?
And then some people have their private insurance from their workplaces or their schools that covers the extra. So if you are traveling, you need to check to make sure that you have travel insurance that will cover. Usually they don't cover pre-existing diseases, but some of them may if you pay extra.
And how about the prescriptions? I think part of self-care is around patients when they have an IBD diagnosis, knowing what their insurance plans cover, so that if they do need a prescription for something, they're not caught off guard, and they have a plan that's able to cover it.
Well, I think for most, like if you're talking about prednisone is actually one of the cheapest medications we have. It's actually quite costly in terms of the side effects. And so it's actually pennies a pill, as opposed to like ciprofloxacin is actually quite expensive, or some of our other biologic medicines are really expensive. And so I think, taking prednisone is actually sometimes cheap to take along, but you have to remember that you take it with risks, because it's like if you do have an infection, it might not be the right thing. In terms of insurance, I think sometimes you have to look at the plans that you buy, but some plans will cover you as long as that pre-existing disease is stable, and so, or it might just exclude you for that disease. And so it doesn't mean if you broke your leg and you have Crohn's disease, it wouldn't necessarily mean that you would.
Patients to get cancellation insurance, which is different than the drug insurance you're talking about. I just interrupted you.
That's a tangential thought.
I know.
Those are used to be just for me. I think cancellation insurance, I think it depends on it depends how much you pay for your trip, I guess, obviously. And if you get a last minute deal, you're probably not going to cancel because you bought it like a week before. If you buy it months or a year in advance, actually, I think it is a good idea to get cancellation insurance. I think you never know. With IBD, we know at any time people might flare, and you can't always predict it. And so I'd hate for you to save a lifetime to go on a cruise, which one of my patients did, and then his wife got sick. It wasn't even the patient got sick, his wife got sick, and they lost a lot of money that he had saved for years to go on this cruise. And because they didn't have proper cancellation insurance, they actually lost out on that whole trip and couldn't even take it at a later date. And so I think sometimes it is worth it for you to buy that.
So that's part of my self-care process, where you have to be thinking about these things and just be cognizant of them, and work with your doctor to make sure that you're doing all of those things that are going to make your life with IBD as normal as possible. Time for another commercial. So I wanted to talk about the IBD website, which I'll get them to put at the bottom of the screen. So www.ibdclinic.ca. That's the IBD website where IBD TV rests. All of the last episodes from the last year are on that site. In addition to a lot of information, we have information there both for physicians and doctors on everything from the diagnosis of IBD to all of the various medications that you may be on. The interesting thing, also fun, there's some quizzes on there, so you can learn about your IBD, take the quiz before, do some reading, take the quiz afterwards. And I'm going to ask Dr. Huang, she's developing a quiz for IBD patients that are pregnant. And Dr. Huang, have you put that quiz yet up on the IBD website?
It was coming soon, in the new year. It will be coming in January.
And I think on the screen you can see this is the face page of the IBD website, and it lists the IBD TV, and we're clicking around on it. But it's to give you an idea of what that website looks like. Here's a section for patients, and you can then go through that: diagnosis, medications, complications, lots of things about operations. Just one something, so that's perfect. Let me just move on to Dr. Huang now, and let's talk about your pregnancy clinic, Dr. Huang, that you've opened, and tell the audience about that. Self-care is about taking care of yourself, being prepared for being pregnant in IBD. So give us a little bit of information.
Maybe over the holidays, maybe not.
Yeah, so we opened up this pregnancy and IBD clinic, and this actually opened for people even before pregnancy, so who are considering pregnancy. And if you have any concerns, you want to talk to somebody about the medications you're on or your diagnosis. A lot of questions people have are like, can I get pregnant? Is it safe to get pregnant because they're on certain drugs like Imuran or Remicade and stuff? So it's just an opportunity for you to ask your questions, and then it follows. So once you become pregnant, we'll follow you during pregnancy in each trimester, and we have a liaison with dietitian, and also maternal fetal medicine, high-risk people, like just for extra.
So if I'm a patient, a female patient, want to come to the pregnancy clinic, how do I get a referral? How do I get there?
Oh, so you have to talk to your gastroenterologist, send a referral to us, or your family doctor, and they can just. Could you want the phone number and everything?
Well, how about not giving the phone number, but how about just giving your name, Dr. Vivian Huang?
Just ask for Dr. Huang, Huang, and then they can find me at the University of Alberta.
It's spelled funny, isn't it?
It is.
H-U-A-N-G.
H-U-A-N-G.
How did you get H-U-A-N-G and not W-O-N-G?
Oh, it's a long story. My grandfather's Mandarin background, and that's the pinyin spelling. Huh? But I'm actually raised as like Cantonese, which is Huang.
That's a little insight into Dr. Huang, why she spells her name funny.
I think the other thing to mention about your pregnancy clinic is that some of the other things we're trying to do in this clinic is actually to collect, do some research. And so I think you also get people to fill out some forms and things like that. And you don't have to do that research. The research is obviously voluntary, but part of what it is we're trying to develop a database of patients that are pregnant so that we can actually learn more about the disease during pregnancy, because often it's a disease diagnosed, as we know, in young people, and we want you to have the fullest life that you can, and that's part of people's sometimes aspirations is actually to get married and have a family, and so that sort of thing. We want to provide the information so that you can make the best decision for yourself in terms of when to get pregnant and if you should get pregnant.
And if I'm a male with IBD, can I attend your clinic?
No.
Eventually. Eventually it will be open.
Eventually. I think it's important.
I think it'd be interesting to know, and we'd be interested to hear. And so if you actually is something you'd be interested in as a male patient, I think you should tell your gastroenterologist, and then that would be something that we would be interested in hearing, to hear that you would be interested to know those things. And it might be more that your wife or partner might want you to actually go to this clinic so that they would be reassured. And so I think there is some value in that, and I think it'd be good for us to know. So
let's move back to the monitor now. There's a lot of questions here. I was recently, I'll do the first one. I was recently in a flare and partially obstructed. That means the bowel was blocked, needing prednisone. Now my prednisone's down to 10 milligrams, so that's a relatively low dose at current. Is it still safe for me to go to Mexico for Christmas, Dr. Huang? Can I go to Mexico on 10 milligrams of prednisone?
So if they're recovered now and they're able to eat and drink and things are staying down and going through, then it's probably okay, but you should speak to your gastroenterologist about maybe not tapering until after you're back, because the issue is that if they continue to taper and they run into trouble, like in their...
So maybe stay on that 10 milligrams and go down to Mexico and then taper when you got back?
Yeah, they should talk to
their doctor. How about taking some ciprofloxacin and antidiarrheals in case they get food poisoning?
They were just obstructed.
That's the thing. So if you just had an obstruction, and then you got to be careful, because if you take antidiarrheals or too much, then you get blocked again, and that might cause problems too.
But you want to get home on the plane without having an accident in the seat. An accident in the seat is always an interesting event.
In moderation. Yeah. Antidiarrheals in moderation.
Right. And the question, and really what Dr. Huang is saying, is that if you have had a blockage of your bowel, and then you start taking a lot of the antidiarrheals, it can actually precipitate another blockage. So in moderation to get you home on the plane, but you have to be careful of how much you do take. So those are other things that you need to talk to your doctor about so they can set the limits for you. Let's go to another question here. Are my medications making me tired? I have absolutely no energy while taking this drug Imuran. Dr. Kroeker.
I knew that
You're the fatigue expert.
I knew that question was coming my way. This summer we actually looked at fatigue in our patients and actually found that a significant number of patients are fatigued. I think it
more than normal, Dr. Kroeker?
More than normal, and they're mostly yours. They're just tired of you.
That's a good joke, Dr. Kroeker. Even the cameraman is laughing, so 1 point. Okay.
So actually, I think it's actually an interesting point about Imuran. And so one of the things is that if you've been on Imuran for a long time, it's probably stable. It's unlikely that it's causing your fatigue. If you're starting out on Imuran, actually that is a side effect that some people get. And so it actually is something that we should consider, and you should talk to your GI about that, because it is a possibility. But if you've been on the medicine for 5 years and now you're having fatigue, I wouldn't probably think of blaming your Imuran.
Let's talk a little bit about your study, because it was very interesting. You found that people with IBD were more fatigued then people match to their same age.
Oh, absolutely.
And what about if your IBD was under control and you were taking the medications, were they still more fatigued?
So actually, it's interesting. So if you have active disease, you're more likely to be fatigued, which
we can understand that.
Sense.
Yes.
But there are a portion of people that don't have active disease and are still fatigued. And so the other thing that we notice is that depression can be common. And so depression is common in people with active disease because some of the symptoms of depression are the same symptoms you get if you actually have a flare. And so we see that for sure. But there is probably still a portion of people that actually aren't depressed and don't have active disease that are fatigued. And so it's actually hard for us to figure out what that is because patients often complain about symptoms of fatigue. And so we're looking at things. And so one of the things we looked at was whether or not you have anemia or low blood counts, if that's causing fatigue, but we actually didn't find that, which is quite interesting. I think if you're really anemic, it's really different, but I think it also would correlate with active disease.
So the answer is, if you have IBD, you're more likely to be fatigued.
But not everybody is, and if you're in remission, you're more likely to not, and if you're not depressed, you're more likely to have good energy.
So do you think it has something to do with sleep patterns? Because I read in some studies that they found association between sleep and IBD.
Oh yeah, so we actually found that in our study too, where we actually looked at if you have no disturbance in sleep, your normal fatigue score is around 40 in the general population. So if you're probably about 40 to 44. Our patients, probably their score was in the high 20s, and so if you actually
high 20 score, is that really bad fatigue or a little bit fatigue?
Less than 30 we consider significant fatigue, and so and about half our patients actually were below 30. And so if you actually look at patients that are not having any disturbance in their sleep, their scores are about, on average, 37, which is still lower than healthy individuals, which have about 44, but it's actually pretty close to the general population. And so we know that they are lower, but it's not as low as our groups with significant...
That's a really interesting findings. We'll be looking for you to publish those results and present them to the world.
I know, if you just gave me some time off to write my papers.
You've got this evening. Okay, let's look at one of the next questions here. I have Crohn's disease and I'm on Remicade and Imuran. Can I take Cold FX, a popular cold remedy invented here in Edmonton, or echinacea? Dr. Huang? Any reason I can't take a herb when I'm on any of these medications?
I'm not sure about these 2 herbs. You'd have to check with the pharmacist, I think, for specific interactions with medications. But
I think the other thing to remember is that the safety of these medications in people with chronic disease like inflammatory bowel disease, or the safety of people on immune suppression, actually isn't known. And so there are rare side effects that you can get from anything, including things that are over the counter. And so I think you have to always be careful. I think the one thing
Who's the best person to ask about this?
I don't actually know. From what I understand,
think it could be the pharmacist?
The pharmacist would know, but I think the complete ingredient list of Cold FX isn't actually available even to the pharmacist, so I don't know that they can give the best advice.
But it's probably a good place to start if you're going to be picking up something from your drugstore to ask the pharmacist, is this something that might interact with my Remicade, my Imuran, my steroids, or whatever other medication that you're on. I think that's a good place to start.
So the one thing I usually tell people to take is a multivitamin with mineral, because often those things are the things that you can be deficient in.
Which one do you like best, Flintstones or Centrum?
I actually like Flintstones for myself, but actually I'm not going to endorse any brand today. Actually, I don't know that there is a difference, but I actually think the mineral part is the part we look for. Something called zinc actually can really help, and patients with, especially with Crohn's disease, can be low in their zinc.
There was an interesting study I want to tell the audience about that was done here quite a long time ago, but in Alberta, where half of Alberta took a multiple vitamin every day and the other half of Alberta didn't, and all of these patients had inflammatory bowel disease. And the inflammatory bowel disease patients that were taking a multiple vitamin every day had less flares overall in a given year than those that were not taking the multiple vitamin. So I think having good nutrition is really important in keeping your IBD healthy. I think that study was before you were born, Dr. Kroeker.
I think so too, actually. How old were you then, 35?
So another question here, just to get away from Dr. Kroeker, is I have C. difficile infection. Oh, so we'll have to ask Dr. Huang to explain what that is. And then the patient says, how can I protect my family and avoid reinfection? This is a really very good question. So, Dr. Huang, what is C. difficile?
So C. difficile is one of the bacteria that's actually in the bowel. And in some people, it's just there, like just as a colonizing bacteria. But in people with IBD and people who are on immunosuppressants, you're at higher risk because of the change in your bacterial flora. And this bacteria can overcome and overtake, and it causes severe diarrhea. It can sometimes trigger a flare of your disease. So it is spread by like contact, like if you don't wash your hands and stuff like that. So the best way, the question was, how can you protect your family and avoid reinfection? Ideally, if you have 2 washrooms, probably try to like use one and then your family use the other, just so they don't come in contact. The other thing is just good hygiene, so lots of hand washing and cleaning of the washroom. Mm-hmm. Lots of washing, lots of hand washing.
You're really scaring me now, because how do I get this infection?
So it's by like contact, like if you touch something that has the bacterial spores on them and then you eat them.
So usually fecal oral contact. You need to have some sort of contact like that.
But the thing is that it's not necessarily that you touch the stool. It's like if you didn't wash your hands properly after going to the bathroom and then you touch something else.
Right. So proper hand washing of the entire family is really important. Let's talk a little bit about who's predisposed to this.
Well, anybody can get it, but you're at higher risk if you have an underlying like inflammatory bowel disease or immune disorder, or if you're on immunosuppression, if you've taken antibiotics recently within the last 6 months, because it can change your bacterial flora, and then you're higher risk. Or if you're older,
Old people.
Yeah, old people.
We know that, Dr. Kroeker. Yeah, so those are some of the particular groups.
And the other thing to remember about with the hand washing thing is don't just use that hand sanitizer. It actually doesn't kill what's called the spores that actually transmit the bacterium. And so you actually should use soap and water, and that's what you should be careful about.
Mm-hmm. So, and if you're high risk, have IBD, elderly, recently been on antibiotics, those are groups that are predisposed to this C. difficile infection. And it can be quite severe, and so we want you to be vigilant about it. And if I think I have that, Dr. Huang, how do I get it diagnosed? Can I go to the drugstore and get a diagnosis? Or?
No, so you need to submit a stool sample. So you have to get
Yicky.
But very important, because it's different treatment.
Is that the only? Can I get a blood test instead?
No, the blood test will just show if you're sick, like if you have inflammation, but it won't show if it's the infection or if it's your flare or something else. So I really need
a stool test?
Right.
And over the holidays, if you think you actually have an infection like this, it's important not to wait. Yeah. And so you probably should actually either go to a walk-in clinic even and get your stools checked, or even go to the emergency room and say you think you might have this infection.
Can I get a requisition for that stool test just by going to the local Medi-Center or family doctor?
Well, yeah, any doctor can write that for sure.
Yeah. So it's pretty easy to get that stool test to know if I have a C. difficile
and I think
infection.
all physicians are well aware of it.
How would I know what should be my symptoms?
If you have like change in your bowel habits, so lots of diarrhea.
Usually sudden onset.
I'm pretty well, and then I get really sick quickly.
And then sometimes when it's really bad, it can get blood. So then that's when you start to wonder.
Icky. Yeah.
I guess the next question, because you didn't answer the question about prevention of reinfection. So do you use probiotics to prevent reinfection of C. difficile, Dr. Fedorak?
So most people will respond really well to a single course of antibiotics. We treat this infection with an antibiotic. There's 2 of them, one called Flagyl, the other called vancomycin, and your doctor can make that choice. We tend to use the vancomycin in people with IBD. And most people will be cured and not ever have a recurrence. But a third of people will get another bout when the antibiotics stop. And once you start having those recurrences is when it's important that your doctor consider putting you on a probiotic to lower the recurrence rate.
Do you have one that you recommend?
The one that's been proven to be most effective, and it's not 100% effective, is one called, the generic name is Saccharomyces boulardii, but it's also known as Floristar, and you can pick that up at any drugstore. Mm-hmm. It's also by prescription, so you'll need to talk to your pharmacist or your physician to get that. Let's go to the monitor, and then we'll have another short commercial shortly. The last question here. I'm a 25-year-old male with ulcerative colitis. Why did my gastroenterologist ask for a testosterone level?
Is that me?
Well, this is a tricky question, and I can answer the question, but I'm going to put you on the spot first, see what you think, Dr. Kroeker.
I think the interesting thing is sometimes they'll accidentally send that to the female patients, and then I really wonder why their testosterone is low, but that's normal in women. And so I think what it is that we know that testosterone is actually really important for bone health, especially in males. And so and so it's actually, that's part of what it is. And we know with people that's ulcerative colitis or even Crohn's disease actually might have problems with their bone health, partly because of the disease, but also partly because we use medications like corticosteroids and prednisone to treat it. And so it's part of us making sure that we're not putting you at risk for having poor bone health, because having a fracture is a significant risk for poor health. So.
Right. So that testosterone level is important in maintaining bone health. And interestingly, patients with IBD or actually any chronic illness will often have a low testosterone level. And that's fine if you're sick with the flu for a few days and your level falls. But if you have inflammatory bowel disease and your level is low for many, many years or many months, your bones will begin to slowly dissolve. And then we know that we're using drugs like prednisone that also dissolve the bones. And so you don't want to be caught as an inflammatory bowel disease patient getting osteoporosis by the time you're 30 or 40 years old. So it is an important measurement that your doctor may do once a year or so, just to make sure that that level is normal. And if it's not, it then needs to be replaced with either there's pills, skin patches, or injections.
Well, there's even a new underarm topical thing now.
Really, how exciting that is.
I learned in the endocrine clinic last week.
Mm-hmm. Next question. I have pouchitis and was prescribed probiotics and antibiotics. Can I take these together? I'll answer that question since Dr. Kroeker and Dr. Huang seem to be tired. Fatigued, actually. I'll do their scores later and I'll let you know what they are. So probiotics would be termed good bacteria that we give people to improve general health, and that's in yogurt. Probiotics can also be encapsulated into pills and be given for certain diseases, in this case, pouchitis. The problem with taking probiotics and antibiotics together is that the antibiotics tend to kill the probiotics, and so you're often not getting the true benefit of the probiotic if you're taking antibiotics together. So often we would have you take them separate. Take your antibiotics followed by your probiotics. There is one exception to that, and that's that Saccharomyces boulardii or Floristar. That's a yeast that's not killed by the antibiotics, and so often your doctor can combine those two together.
We don't usually use that Saccharomyces to treat pouchitis, right?
Correct. Pouchitis is generally treated. It responds very well to antibiotics. Get the pouchitis under control, and then take the probiotics to keep it under control. Simple.
So now with the pouchitis, you used to do the studies with the VSL number 3, and that used to be hard to get, right? So is that now available for pouchitis?
So VSL number 3 is available for pouchitis. It's not covered by all insurance plans, like many drugs, and so you sometimes will have to pay out of pocket for that VSL number 3, or have a drug plan that will cover that cost.
Mm-hmm. And it's not a very cheap. It's not a cheap medication.
No, it's about several $100s per month. Most medications run into several $100s per month. Some of the biologic medications are running into thousands of dollars per month, which is why we really encourage you, as part of the self-care, make sure that you have a drug insurance plan that covers these medications. Make sure that you're thinking about that ahead of time, so when you need the medications, that insurance plan is there for you.
Can we ask you the next question? Is there a risk for a guy with Crohn's disease taking protein shakes?
You're talking about the protein shakes that you can buy at the health food stores?
Yeah.
So here's my mantra about that. I think that I recognize that most young men who are lifting weights are going to be taking protein shakes. And in general, there's not a lot good about that. There's not a lot bad about that. If you were eating adequate protein in your diet, you wouldn't need this extra supplements. That doesn't help you build muscle any more than if you're eating regular protein. You have to be careful with those protein shakes. That protein often gets cleared out of the kidney, and that can put quite a stress on your kidney, particularly if you're taking massive amounts of that protein. The thing that I want to caution you about is some of the steroid drugs that are available at some of the gyms, and you need to be careful about that. They will exacerbate and make your Crohn's disease or ulcerative colitis worse. So that is a major thing that you need to avoid. All people need to avoid that, but particularly if you have inflammatory bowel disease, you'll make your disease worse. We've actually had several people who didn't have inflammatory bowel disease began using steroids in one of the gyms and then developed IBD. It was relatively severe, so it's a major problem. So let's just go on to some of the last questions here about self-care. Dr. Kroeker, you've had lots of experience treating people with IBD. What are some of the things that people do wrong around Christmas time that can get them into problems?
I think the one thing that people, it's actually difficult to remember to take your medications. And I think often people have a pretty good routine during a regular day when you get up early in the morning and you go to work and then you go to bed at a reasonable hour. But I think often in the holidays, your sleep patterns are disturbed and you actually forget to take your medications. And so that's one of the things.
You're so excited that Santa Claus is coming that you forget.
Well, I think people just you're not normally at your house. And so the one thing is you probably should keep a supply in your purse if you're a lady. I don't know where boys keep their medications. But I think what it is to make sure you carry those with you and
things like that. We give them to our partners.
Okay, perfect. And
carry for us.
Or you could have a man purse, I guess.
Possibly.
But I think the one thing is, and maybe even have an alarm system on your phone or something like that, that actually can remind you to take your medicines. Because I think it's true, it's harder to remember when you normally take your medicines in the morning first thing and you don't get up till 11 one day and you run off to a brunch or something you might actually forget to take because you don't have the normal cues that remind you to take those things. So that's one thing. The next thing is that if you're traveling, you need to talk to your doctors beforehand to see if you maybe need to take some antibiotics depending on where you're going. And then the last thing is actually to remember to sleep, remember to drink in moderation and to be aware of your body still. You have a chronic illness and so you can't necessarily stress your body quite the same as the average person. And so you need to take care of yourself because I think, even if you have to leave a party an hour early because you're going to sleep better, you're going to have a better life if you actually are still well the next day.
I just want to talk about one thing that didn't come up on the questions, and that's the high-fat foods. So high-fat foods at Christmas are everywhere.
Plethora.
The chocolates, the cookies, the cakes, all that. The fat that is in that food can actually cause a lot of trouble with your large intestine. It causes the large intestine to contract, and you can get quite a bit of diarrhea, pain, cramps just by eating those high-fat foods. And so that's particularly true in people with inflammatory bowel disease. So those high-fat foods, if you're noticing that your bowels are getting a little bit uneasy and you think you may be having a flare, it may not be the flare, it just may be the symptoms from all of that tasty food.
I think that's why we look at your overall picture and see how well you are. And remember, it's often is that it has to persist. And so, back off on that type of rich food and eat a little bit bland or try to eat some healthy food some days.
I also think people, if you have Crohn's disease that have narrowings and you know that you have narrowings and you've been advised to eat the low fiber diet, I know it's really hard over the holidays because you want to have the popcorn or all that stuff. But if you know it's going to possibly cause an obstruction, then just stay away from those. That's the advice I would give.
Temptation.
Yeah.
So on that note, let's bring IBD TV to a close today. I wanted to again thank our sponsors, AbbVie Canada, that's provided an unrestricted educational grant that allows this series to continue, to the Canadian Digestive Health Foundation for its support, the Crohn's and Colitis Foundation of Canada for their support, and of course the University of Alberta, which helps support this website, www.ibdclinic.ca, where all of IBD TV from this last year has been seen. So we wanted to thank you for being with us today, and to all of you out there, happy holidays, and we'll see you again next year as IBD TV continues in 2014.